Early warning signs of colon cancer you should not ignore. Today, we're discussing an important topic, the early warning signs of colon cancer that you should not ignore. Colon cancer, a leading cause of cancer-related deaths worldwide, often goes unnoticed due to its subtle symptoms. Understanding these early signs can be crucial in detecting the disease early and increasing the chances of successful treatment. Let's begin by understanding what colon cancer is. Colon cancer starts in the large intestine or rectum, forming initially as noncancerous polyps. Over time, some of these polyps can turn into cancer. Early detection is key because when found early, colon cancer is highly treatable. So, what are the early warning signs of colon cancer? Let's dive into them one by one. But first, make sure to follow the channel and like this video to support our work. 1. Changes in bowel habits. One of the first signs of colon cancer can be changes in bowel habits. This includes new onset constipation or diarrhea, a sense of incomplete evacuation after a bowel movement, or more frequent bowel movements. If these changes last for more than a few days, it's important to consult a doctor. 2. Blood in stool. The presence of bright red blood in the stool or darker stools might indicate bleeding in the colon. While hemorrhoids can also cause blood in the stool, any bleeding should be checked by a healthcare professional. 3. Persistent abdominal discomfort. This can include frequent gas pains, bloating, fullness, or cramps. If you're experiencing persistent abdominal discomfort, especially if it's a change from your usual pattern, it's important to get it checked out. 4. Unexplained weight loss. Losing weight without trying can be a sign of various medical conditions, including colon cancer. If you're losing weight and haven't changed your diet or exercise habits, it's important to discuss this with a doctor. 5. Weakness or fatigue. Persistent. Weakness or fatigue could be a symptom of colon cancer. This could be due to the cancer itself or a result of blood loss from the tumor. 6. Anemia. Anemia, a condition where you lack enough healthy red blood cells, can be an early sign of colon cancer. This is often related to bleeding from the cancer, which might not be visible in the stool. 7. Narrow stools. A change in stool caliber, particularly pencil-thin stools, can be a sign of a tumor in the colon. 8. A feeling that your bowel doesn't empty completely. If you consistently feel that your bowel hasn't emptied completely after a bowel movement, it might be a sign of a blockage in the colon due to cancer. Remember, having one or more of these symptoms doesn't necessarily mean you have colon cancer. Many of these symptoms can be caused by other conditions, like hemorrhoids, IBS, or an infection. However, it's important to take these symptoms seriously and consult a healthcare provider for a proper diagnosis. Let's also talk about risk factors for colon cancer. Age is a significant risk factor, with most people diagnosed over the age of 50. However, there's an increasing trend of colon cancer in younger adults, so don't ignore symptoms based on age alone. Family history of colon cancer, certain genetic disorders, a personal history of polyps, inflammatory bowel disease, a diet high in red and processed meats, physical inactivity, obesity, smoking, and heavy alcohol use are other risk factors. Now, let's discuss the importance of screening. Screening for colon cancer can help detect the disease early, even before symptoms develop. There are several screening tests available, including colonoscopy, stool tests, and others. Your healthcare provider can recommend the best screening test for you based on your risk factors and preferences. If colon cancer is detected early, treatment is more likely to be successful. Treatment options include surgery, radiation therapy, and chemotherapy. The choice of treatment depends on the stage of cancer, the location of the tumor, and the patient's overall health. In addition to medical treatments, lifestyle changes can also play a role in reducing the risk of colon cancer. This includes eating a diet rich in fruits, vegetables, and whole grains, maintaining a healthy weight, exercising regularly, limiting alcohol consumption, and avoiding smoking. It's also important to be aware of the misconceptions surrounding colon cancer. Many people believe that if they don't have a family history of colon cancer, they're not at risk. However, most colon cancers occur in individuals with no family history, Another common myth is that colon cancer is a man's disease. In fact, it affects men and women almost equally. In conclusion, being aware of the early warning signs of colon cancer and taking proactive steps for screening and prevention can save lives. If you experience any of the symptoms we've discussed, please see a healthcare provider. And remember, early detection and healthy lifestyle choices can make a significant difference. Stay informed, stay vigilant, and prioritize your health. Thank you for watching, and don't forget to like, share, and subscribe for more informative content.